Welcome back to Ohio Counseling Conversations, the official podcast of the Ohio Counseling Association, bringing you updates and conversations from around the state. On today's episode, we're privileged to host Dr. Cynthia J. Osborn, Professor of Counselor Education and Supervision at Kent State University. With a distinguished career spanning counseling education, addictions counseling, leadership, and professional organizations, Cynthia brings invaluable insights to our discussion. Join us as we explore Cynthia's expertise in addictive behaviors, case conceptualization, and motivational interviewing. From her groundbreaking work in federal awards to her leadership roles, her contributions to counseling education and practice are quite remarkable. As usual, I am your host today, Dr. Marisa Cargill, a counselor and counselor educator in Northeast Ohio. Stay tuned for our captivating conversation with Dr. Osborn, a trailblazer in Ohio counseling. Let's begin. Cynthia, thank you so much for joining us. We're happy to have you.
Thank you for having me. This is a pleasure to be a part of this conversation. Thanks for the invitation.
Yeah, we're so excited. So we always sort of start off our episodes with allowing you to introduce yourself a little bit to the listeners and tell us a little bit about yourself.
Sure. Well, I'm a professor of counselor education and supervision at Kent State University here in Northeast Ohio. And I've been here more than 25 years. Started as a very fresh assistant professor and have stayed here since. This is a good place for me to be, allows me to work in a variety of tasks that I find very fulfilling. So certainly the teaching, the research opportunities, the service opportunities as well. So I've been able to benefit from the opportunities or menu of opportunities that are available here. So it's a good place to be.
Mm-hmm. And in reading your bio, I noticed like your journey in like helping and being with people has expanded beyond counseling and academia, that there's been like pastoral ministry and it's kind of transitioned over the years into where you are now. What inspired you to go into counseling, and how do you feel like each of these roles has maybe contributed to your experience as an educator?
Sure. Yeah. Thank you for that question. Well, I have to go back to my upbringing in many ways to credit my parents, Noel and Emma Ruth Osborn, who were United Methodist missionaries in the Philippines for 37 years. And so my older brother and I were born in the Philippines and raised as missionary kids. And it was actually my mother who had what she would say, the calling to become what she would say at that time, foreign missionary. And so her service and her desire to work with people in a serving and also a teaching capacity was an inspiration, continues to be an inspiration for me. My father, at a point when I was in maybe starting in sixth grade, that he started a PhD program in theology. So we moved back to the States for him to do his PhD degree here, in Nashville at Vanderbilt University. And so at the age that I was when he was in a doctoral program, I was able to witness his studying, also just his love of, I'll say, scholarship. So my father, for me, is a scholar, and his influence was, I knew at some point that I wanted to pursue a doctoral degree. I just didn't know at that point what it would be in. So in many ways, both my parents inspired me to, after my college degree, to pursue a master's degree in divinity. So that's my master's degree is in divinity, and I served in pastoral ministry for about 7 years altogether. And it was during that time in the parish, in one local church, that I learned that I really found fulfilling to work directly with parishioners in providing counseling. And I put air quotes counseling on purpose, because it was only after I was in a doctoral program in counselor education and supervision that I realized I did not have all the skills that I needed to provide counseling, but I found that role very fulfilling. And I also found fulfilling in the parish role, clergy role of preparing for sermon preparation, Bible study. And it was that type of study that I likened to like the scholarship that my father was involved in, that's what I found fulfilling. So when I learned of a profession called counselor education, it was like a marriage of those two roles that I was engaged in the local church. And it was then I realized this is the discipline that I want to pursue a doctoral degree in, and certainly has provided the opportunity for me to, practice counseling, to engage in scholarship, to teach. And I find the teaching role, being in the classroom, very fulfilling. So that's how my journey led me to this spot.
Yeah, it's always an evolution for I think many of us. We talk about this with a lot of our guests, but the evolution for all of us looks different, but it does marry a lot of some of our past experiences that bring us to the present day and what we feel like will be the ideal profession or ideal fit for us. So I
Mm-hmm. Yeah,
appreciate you sharing that.
yeah, sure.
Uh, in your experience in this field, we have learned, like through reading about you, through hearing so much about you, through maybe some of the listeners have seen you present or have had you as a professor, that one of your specialties is motivational interviewing. Can you tell us more about that approach and how it supports clients in counseling?
Sure. Well, motivational interviewing is an approach that was developed in the addictions field. William Miller, a distinguished emeritus professor of psychology at the University of New Mexico, is the one credited with developing motivational interviewing in his work with persons with substance use disorders. And this was back in the early 1980s. And the work, how he was trained to work with persons with substance use disorders, other disorders as well, very much a cognitive behavioral approach, and very much what change oriented. And realizing in his learning, in his work with persons with substance use disorders, that change cannot be imposed on persons. You can't change somebody's mind. You can't pull them into change or push them into change. And he was also very much influenced by Carl Rogers, so a person-centered approach. And so in many ways, you could think of motivational interviewing as a marriage, an adaptation of person-centered, and aspects of cognitive behavioral, like an approach of change. So many ways, motivational interviewing is a person-centered approach that is directive towards change. Doesn't mean that we're directing people to change, but that change is the point, that the direction, maybe I should say directional, that change is the direction. That's the point. And it also, motivational interviewing also promotes persons' autonomy or decision making, that it's not for anybody else or no system to impose change or to impose ideas onto persons. And those with substance use disorders who are in a system of treatment, historically and still unfortunately today, have been imposed upon, have been told, this is the program that you need to follow. These are the words that you need to say to indicate to us that you are speaking our language, and that anything that deviates from that, you are in denial, you are not telling the truth, You are rationalizing. So motivational interviewing is really an antidote to a 180 approach to those conventional imposition or coercive approaches. In addictions, yes, but also in other forms of care now, medical care that no, you have to accept your diagnosis and you have to say this in order for us to um, provide you with these services.
Right, right. It's more about conformity in some of maybe the more traditional approaches than actually exploring what will help.
Exactly. Yeah. So, yeah, in many ways, you use the word conformity. In many ways, motivational interviewing is a nonconformist approach.
Yeah, 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 that's what I'm hearing. Because that was
Yeah.
the word that immediately came
Yeah.
to mind when you were
Yeah.
describing that
Uh
to me.
huh.
So yeah,
Yeah.
yeah. Yeah, you've had a lot of experience in specifically motivational interviewing, and you're a member of the Motivational Interviewing Network of trainers. How have you seen this approach evolve over time?
It's evolved greatly. So I've been a member of the MINT, the Motivational Interviewing Network of Trainers, for 22, 24 years now. And since that time, MI has, Motivational Interviewing, I'll refer to as MI,
Mhm.
has expanded to a whole range of settings, professions, disciplines. So it has expanded beyond the addictions field into healthcare, education, other types, specifically, medical care, including dental care, public health. Um, Also, in terms of sports or athletes, so Steve Rolnick, one of the co-developers of motivational interviewing, his a focus of his more recently in recent years has been working with athletes. I think maybe professional athletes as well, helping them in general. How do I, as a helper, practicing from a motivational interviewing approach, how do I assist this person in being able to change in the direction that is necessary or appealing for them? How do I support them in that effort? And how do I do that by, think about motivational interviewing as a conversation about change. It really is a style, a method of communication. And so MI helpers are ones who listen very carefully to the type of language that is voiced by the client or patient person, and listening specifically for indications of what we call change talk.
Mhm.
That, yeah, I do want to. It's not something that it's something I'm terrified about, but I know I've got to do it. When I hear I've got to do it, maybe, those to me ring change talk. And from
Mhm.
a behavioral perspective, that's what I'm going to reinforce in my response to the person. Um, so this is something that you really have been thinking a lot about, and it's almost as if you are convincing yourself that this is the direction for you to go. Does that does that sound? Am I on it? Is, yeah. So
Mhm.
ask a question to check in. Yeah.
Yeah, reflecting like that change talk back to them to
Exactly.
really validate it, but also to reinforce like what they're sharing with you.
Yep. To strengthen that talk of change. That doesn't mean, repeat after me. Say, that frequency.
Right.
It's um, the strength of that talk about change. And it's also, that's, I'm using what the client or the speaker is providing. It's not like I'm installing any kind of language. I'm not putting words in their mouth. I'm using what they're already presenting. And
Mhm.
that, that takes a lot of attentiveness on my part. And it also takes an ability to really listen carefully to how this person is presenting what they're saying. Not just the words, but what's behind the words. What might be the emotion? What might be the thoughts behind the words? And so you mentioned reflection, and those reflections, I'm it's it's kind of an oxymoron that reflections are a guess about what the person means. I mean, it's a statement, it's not a question, but it's a guess as to what the person means. And I offer that as a statement. My tone goes down at the end, and the person can, should be able to
Mm-hmm.
correct me if I'm off. And that's
Yeah.
feedback for me. And then we continue in this conversation.
Yeah. Yeah. That there's that accuracy like check or like implied with the tone of voice or based off of the relationship that you've already built to,
Yes.
hey, you can correct me if I'm wrong. But it
Mhm.
sounds like there might be some change that is desired here.
Yes, yes. And you
Yeah.
mentioned accuracy, and in many ways, I mean, it's Carl Rogers who uses the term accurate empathy, and motivational interviewing really focuses or does focus on the helper, the MI helper, engaging in accurate empathy. And how do we know it's accurate? It's based on the feedback that we get from the client or the patient, whether we're on target or not. And even if we're off target a bit, the person who's having a conversation with us will know we're making the effort to understand, and to understand, as you said, in an accurate way, one that hits home for them.
Mm-hmm. Mm-hmm. And when you described that, it brought even more of the marriage between the two theories to me because it's behavioral in some ways, but relational in other that brings that person centered, like we have to have a relationship here.
Mhm.
So that really highlighted that well for
Very much
me.
so. And
Yeah.
with relationship, I'll just add to that that the initial and foundational task of MI helpers is that of engaging. That I need to engage with persons first, rather than going to one of the next tasks, and that of like planning. Well, we haven't yet. Um, it's more than rapport building. It's how do I, as an MI helper, um, convey to you my attentiveness and my um, desire and investment in understanding you in a way that fits for you. How do I earn your trust that I am a um, trustworthy person, and one who's a caring person, here to be able to help you, and I'm not in it for me.
Right. Getting their buy-in, but in a way that isn't like I'm trying to sell you a dream here. I'm trying to get your buy-in so that you believe there's change that is like you're capable of making.
Yes, very much so. Uh-huh.
Yeah. Yeah. You know, you mentioned the roots in MI being connected to addictions. What role do you feel like it plays in addressing addictive behaviors?
Oh, it's been a breath of fresh air for many, many years. And I would say that today, for persons working in the addictions field, that an MI approach, an MI understanding, I would say is essential, um, to because persons with substance use disorders have more than likely been pushed around by systems,
Mm,
have not been taken seriously,
yeah.
have been accused of bringing uh, the addiction, the disorder on themselves, volunteering, to have an addiction. And so, an MI perspective um, certainly is a 180 from that accusatory stance. Again, that unfortunately many providers may
Mm-hmm.
still engage in unknowingly, inadvertently.
Mm-hmm. Mm-hmm.
So, MI brings a breath of fresh air, and I would say, yeah, healing to persons struggling with addictions.
Mhm. It sounds like it's healing and maybe a bit destigmatizing.
Very much so. I mean, I would hope that that is the one of the outcomes, if you will, of someone who is the beneficiary of a helper trained in MI and who is, if you will, delivering MI in the way that it is intended to be offered, provided
Mhm.
to others.
Yeah. Yeah. So that sounds like it might be one misconception about maybe the work that you do as an MI helper. Are there other misconceptions that you feel like are pretty prevalent in this type of approach?
Specific to motivational interviewing, yes, I would say that too often motivational interviewing is minimized as just person-centered counseling.
Mm.
It's also um, misconstrued as simple, as what you're already doing,
Hmm. Okay.
as working from the stages of change model. That's a very frequent misconception. So the stages of change, part of the trans theoretical model, that and MI were developed around the same time, but by two different persons, both work in the addictions field. Um, Motivational interviewing and the stages of change can work well together. Bill Miller has said, kissing cousins who never got married, stages of change and motivational interviewing.
Yeah,
So
yeah,
they
that
can
that
be
makes
used,
sense.
yeah, they can be used together, but they don't have to be. So,
Mhm.
thinking of, well, that someone that motivational interviewing is appropriate for somebody in a pre-contemplation, and pre-contemplation is not really a stage of change. It's like change cycle, but is appropriate for somebody in pre-contemplation or contemplation. Yes, but you don't even have to use reference to stages of change for MI
Mhm.
to uh, to be applied.
Okay, okay. In addiction and recovery spaces, are there some general misconceptions around that work as well?
Hmm. Yes, I would probably say that it's going back to that it's simple or it's easy to do, and that it goes against how we have historically done things around here. Well, how we've historically done things around here might be a persuasive approach
Mhm.
that uh, you have to, quote, get with the program, do things our way. So some maybe in the addictions field might discount MI because it doesn't fit with how, quote, we've done things for many years.
Mhm.
I mean,
Mhm.
I hope that's changing. I believe it has, um,
Yeah.
but I hope it continues to change. And in many ways, it all depends on how persons are trained in motivational interviewing. And if it is something that is mandated and you sit in a workshop for 3 hours or 6 hours and somebody is talking to you about motivational interviewing and you don't have the opportunity to practice the skills that are a part of this approach and get feedback on your practice, then you're not being given the opportunity to really appreciate the essence and the value of motivational interviewing. It just becomes something else that I had to do, I was told to do. And, that in itself is so contrary to motivational interviewing,
Mhm.
mandated.
Yeah. Yeah, yeah. When I'm hearing you talk about this, I'm thinking like those historical approaches may, align with like the medical model a bit and some like deficit-based speak
Yes.
where it sounds like this is more about empowering people to to work on change that they feel is like in their control.
Yes, it very much so. That they have the capacity, they have the right
Mm-hmm.
to be able to make decisions on. Very much so. Yeah.
Mm-hmm. And like we said before, it's destigmatizing to go that route, and instead of maybe like problem based, deficit based
Yes.
speak.
Yes.
Yeah.
Yes.
Yeah.
Motivational interviewing is very much a strengths based approach,
Mm-hmm.
and
Yeah.
we as MI helpers, we have to believe that motivation, change, the seeds of change, the seeds of motivation for change already exist in another person. We have to believe that. Otherwise, we're not being true to the spirit of motivational interviewing.
Mm-hmm. Yeah, and I think when I think of the definition of counseling, right, it talks about empowerment. So I would say to some degree that expands even like as counselors, like we should have this belief in people being capable of change.
Yes, yes, very much so.
Yeah.
Agreed.
Yeah.
Uh,
Yeah. So from your perspective, I know like that, you've served in the clinician role, you've served as an educator. What are some of the pressing issues or gaps in like addiction counseling education and practice, and how do you think we can address those at academic and professional levels?
Yeah, sure. I would say that one is to what uh, dismiss a belief that the only persons who are able to provide care to persons with substance use disorders or other addictive behaviors are persons who are in recovery themselves from substance
Mm,
use disorders or other addictive be- behaviors. Um, if that was the case, if that was true, I would not have been able to practice in addiction care as someone who's not in recovery from a substance use disorder. So I'm just grateful for the opportunity that I had, that still experiences I had working with persons with substance use disorders, to be able to learn from them, and for me to perhaps have a some influence, hopefully a positive, maybe healing influence in their lives. So that's the first thing. And I guess another one is that um, addiction is not, I don't know how to say this exactly, addiction is not an individualistic condition. By
yeah.
that, I mean that um, people don't bring this on themselves. And it doesn't just affect them, it affects other persons, certainly, yes, family members, community members, society at large. And our approach as counselors has been individualistic. We
Yeah.
treat, we care for individual persons. And I believe that as a profession, as counselors, how can we adopt more of a macro approach? I know this is true for public health. Public health is a macro, has a population based perspective. How can we, as counselors, appreciate that macro approach a little bit more, a systems approach, and not just systems in terms of family systems, but systems in terms of um, legal entities, or those, policymakers, those who are in decision making, elected officials who are in decision making roles that have implications for a wide range of persons. And so to address addiction is not to address the individual only
Hmm.
with a substance
Right.
use disorder, but to address the system in which that person lives, and in which that contributed, or those systems contributed to developing
Hmm.
substance use disorder. And I think that's pretty Yeah, like to quote, blame an individual for the condition they have, as opposed to, well, let's look at the conditions, the shared conditions in which this substance use disorder or other medical condition was developed. Well, so we need to address poverty, we need
Mm-hmm.
to address crime, we need to
Yeah.
address um, trauma, uh, we need to address other aspects of public living, like, you know,
Mm-hmm.
clean access to clean water, access to
Yeah.
education, access to healthcare services, uh,
Mm-hmm.
that we as a system have contributed and we continue to contribute to um,
Mm-hmm.
addictive behaviors, uh, what
Yeah.
we developed. Yep.
It's hard to like fix something on an individual level when the systemic issues persist.
Yes. Yes. Very much so. Mhm.
Yeah. Yeah. I gosh, we could have a whole episode on that, probably several episodes.
Yep.
So
Yep.
we might need to have another conversation about that, but definitely, yeah, I see what you're saying in that like yes, we are going to treat the individual, but until we also address these other things, like we're asking people to then go navigate and encounter the same things that have been maybe supportive in creating some of these problems for
Yes.
you.
Yes.
Yeah.
Yep.
Yeah.
Very much so.
Yeah. And it seems like you as a professional have been quite the advocate and have gotten involved in trying to address some of these systemic issues and have even received some federal awards focused on addiction counseling education, project enhance it, the accept program. Can you tell us more about those initiatives and their impact?
Yeah, sure. So fortunate that we at Kent State and I, as the principal investigator of both of these projects, were able to receive federal funding. Um, both of them are training grants. The one from SAMHSA, that's the Project Enhance It, to develop curriculum to help um, prepare persons to become addiction providers and to offer what I hope is enhanced training, including being able to hear from persons who are clients, portraying clients about their experiences on video, and then having opportunities, those prompts to what would you say to client Rusty that you've just seen on video. And also for students to have an opportunity to see demonstrations of uh, encounters, counseling sessions with who are conducted by experts in the field in Northeast Ohio, also Central Ohio. One of my peeves as an educator over the years has been that the demonstration videos that I have access to, well, there are persons in the field who are, all over in the United States, and maybe these videos are not current. And so for Project Enhance It, developing training videos that really showcase those addiction experts who are right here close by geographically, close to where the students might be, say at Kent State, and for the students to see others in action. And then the experts reflect in another set of videos on their work with the simulated client that they had a conversation with.
Mm-hmm.
The accept, go ahead, I'm sorry.
Oh, I was going to say that seems um, really pertinent because I feel like students are often wanting the more practical experiences and that gives them also like relevant to like what might be happening in the communities around them.
Yes,
So it gives them some better understanding of the systems where they most likely will go on and work. Yeah, so
yes,
I love that.
yeah. And some of the videos too showcase former clients and also addiction counselors talking about their experiences. And
Mhm,
one video has a segment of public health workers, outreach workers in Cleveland who
mhm,
work with persons with substance use concerns, who are not necessarily clients or patients, but they are in need of certain services. And um, so I really value or certainly appreciate the funding we receive to be able to make
Yeah.
this curriculum possible. And
Yeah, that's
the
wonderful.
ACCEPT program is funding from another federal agency that's also a training grant and a workforce development grant. So students at Kent State University who are part of the ACCEPT program are enrolled in our certificate in addictions counseling here at Kent State, and they receive tuition assistance and then a stipend during their practicum. So those monies come from the federal award, and they also receive enhanced training, like working with simulated clients on video. We filmed additional videos after Project Enhance It just for the
Hmm.
ACCEPT program. And then we have a live in-person client simulation practice time for them. And this is all in to help them prepare for their actual practicum when they're out in the field working with actual clients and patients.
Right. Yeah. Yeah, because even if you're not specializing in addiction, it's really probably impossible that you wouldn't encounter someone who's struggling with some type of addictive behavior or substance
That,
related issue.
that's for sure. Uh, we can't abstain from that.
Nope,
that
can't cookie cutter those apart.
yes, that's right. That's right.
Yeah, yeah. Oh, those programs sound really, really awesome. And we can try to make sure if you have any resources, we can link those
Okay.
in our show notes to,
Thank you.
have folks learn more about them. Speaking of people who would want to learn more about maybe working in the field of addiction and recovery, what kind of advice might you give them if they're interested in navigating more toward this specialization?
First, I thank them and I tell them that your work is needed and that jobs are available for the essential work that you will be engaging in. Um, Needing to have compassion, the ability to stretch their empathic skills. Empathy is a skill for me, not something that's a given, and I have to constantly work on that, stretch my empathic muscles.
Hmm.
And that this work is very rewarding. Learning from a wide range of persons about their experiences and their perceptions on those experiences, and that no one's experience of addiction is just like another's. I mean, there's very much persons who have a bent for existential theory. Um, Addiction work is very much in line with that. What brings you meaning, your role, uh, and how do you pursue that type of life? I guess I'm now thinking about dialectical behavior therapy that talks about a life worth living. But how do you uh, are able to establish that type of life, pursue that type of life, that self
Hmm.
identity?
Hmm.
Yeah,
Hmm.
I may be veering off on the question that you asked.
Yeah, no, I think that that's great advice. It's sort of um, a little bit of a checklist, but understanding like it's, I guess, like rewarding, but does require like that, that you really intentionally engage in it, and you still are able to integrate like maybe other theoretical perspectives beyond MI, if that's something that you're inclined to, because it is meaningful and really part of that meaning making and exploration with that with our clients does help us maybe come back to some of the things that might be motivating them in their change journey.
Yes, and there's also something I'm sure that in the counseling students or counselor or helper in general's own life that can connect with somebody who is struggling with substance use or another type of addictive behavior. It may not be direct experience, but there's something about uh, connecting with the pain, the hurt, the loss that is active addiction. Um, and in many ways, specific to substance use, substances in many ways are used as a vehicle to um, alleviate some type of pain,
Yeah.
some type of loss, whatever that is for that person. And so, in many ways, addictions counseling is not just about specific to substance. It's not about just about the substances being used. It's about the reasons or the um, what substance use is trying to alleviate for that person.
Mm-hmm. Why it was a coping tool for them.
Mhm.
Yeah. Yeah. Looking ahead, when you think about like the future of addiction counseling education, what do you envision in terms of like what will be needed there?
Sure. I mean, this is an excellent question. And I'll harken back to what I mentioned earlier is for addiction care providers to learn to work with or also to have a wider perspective of systems of care and not to quote treat persons in isolation or silos. You know, addiction is, as a profession, if you will, is multidisciplinary.
Yeah.
And so, how do we as providers collaborate with providers from other disciplines um, that represent other systems
Mm-hmm.
persons struggling with substance use are a part of? So, I mean, yes, certainly criminal justice, but also public health, medical professions, um, family systems. Think about job and
Yeah.
family services,
Yeah.
supports that they provide. And I would also say um, political systems, those who are elected officials,
Mm-hmm.
assisting them with their decision making, not just but educating them, I guess. All
Mm-hmm.
um,
Yeah.
yeah,
Helping them understand the reality of like experiences of the people we help.
yes, yes,
Yeah.
and
Yeah.
how to integrate addictions care, and I use care instead of counseling to that broader,
Mm-hmm.
uh, more general word delivery. How addictions care can be integrated or embedded in more systems. Um,
Mm-hmm.
like
Mm-hmm.
um, urgent care centers or express care centers. Like the local pharmacy that may have express care. Well, why is that just for certain medical conditions? Why not have an addiction care professional at that local pharmacy? Now that's still maybe individualistic, but um, again, a larger approach, and perhaps for persons who are addiction care providers to seek um, elected positions,
Yeah.
city council,
Yeah.
um, to help and make decisions for that affect a wider range of people.
Mm-hmm. Yeah. Making those individual supports a more common occurrence in the systems. And so, like, looking at the layers and seeing where we can contribute, maybe on an individual level, but also on a macro level, like you said, in advocating or maybe even entering the political arena ourselves.
Yes, very much so. Yep.
Yeah, wonderful. I know the last question sort of touched on this a little bit, but for aspiring counselors, counselors in training, people who maybe haven't entered the field yet, like, is there any additional advice you would give to someone who maybe is considering this specialized field?
I would say be sure you get a well-rounded education, and be sure that you are studying, you have access to um, resources that prompt you to consider other perspectives, other theories of addiction, rather than maybe just one. Um, and at the same time, then be able to expose yourself to a wider range of approaches to addictions care as opposed to, say, just one, because there are many available and many that are evidence based. So the research to support that. So don't limit yourself to one way of thinking and one
Mhm.
way of doing as an addiction care provider.
Yeah. And I think that speaks to the earlier conversation of like that historical approach. We sometimes, and not just as counselors, but I think as humans, like sort of stick with what we know. And that's not always the most effective approach, even if it's what feels like the most familiar.
Yes, yes. And
Yeah.
I would say, going back to motivational interviewing, one thing I really appreciate about MI is its emphasis on practice with feedback. That
Mm,
I can't learn a new skill, or I can't learn to engage in a skill in a consistent um, and a what faithful basis, meaning I'm being faithful to the
hmm
method,
hmm
without my practice being observed or witnessed by somebody else, and somebody else who knows about that practice, like as a you know um, like a coach, or um, a I don't know, conductor. Like I think about an
Yeah.
orchestra
Yeah.
or
Yeah.
a
Yeah.
conductor. I need
Sure.
somebody to observe my practice and provide feedback to me on my practice. So, for those who are wishing to pursue this field, be sure you have opportunities to practice that maybe are video recorded or observed live, and that you get the specific feedback on your work that you need and deserve to
Mhm.
improve your skill set.
Yeah. Quality assurance.
Yes, true. It's another way of thinking about it. Mhm.
Yeah. Yeah.
And and it's also, you think about that quality assurance to make sure that the recipients of care are
hmm
are getting what you said that you were providing for them.
hmm Yeah. To our own ethical responsibilities as well,
Yeah.
right? Like, yeah, that all sort of marries together too. That we need to have that in order to make sure we're doing the best for our clients.
Yes. Yes. Mhm.
Yeah. Yeah. So I've enjoyed this conversation so much, and like I said, we probably could have a million more based off some of the topics that came up today. But in the interest of time and you know, kind of wrapping things up, we asked this next question of all of our guests because the name of the podcast is Ohio Counseling Conversations. So we think it's important to understand your perspective in knowing what important conversations you think counseling professionals should be having with each other and or their clients in our state.
Well, it's again, it goes back to um, or touches on, and the word that comes to mind, or the term that comes to mind, is reach across the aisle. So work with other entities, other systems, um, such as legal representatives, those who are, who work with for the Ohio Counseling Association, how to make use of their services, continue to make use of their services, and learning the lay of the land, so to speak, what is forecast politically, and in many ways, everything's political. In addictions field,
Right?
everything's
Yes.
political, everything's economic. Think about all the
Mhm.
economic forces and political forces that have continued to be at play when it uh, comes to addiction and substance use disorders. Um, how to continue to engage in social justice advocacy. Um, Persons are who have substance use disorders are often, as we mentioned earlier, are often persons who have been relegated to the periphery of society, and are not um, respected or taken seriously. So how can we as counselors engage with other partners, whoever those representatives are of other entities, to provide what we would say is holistic care?
Yeah. Yeah. Recognizing humanity in we recognize that, I think, as our profession, but like helping others
Yes,
really recognize those like layers, but that there's humanity in every single one.
yes, yes. Very well said. Very well put.
Yeah. 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 Well, we appreciate you joining us so, so much. Is there anything else you'd like to add or share with us today?
Not that I can think of. I just want to say thank you for this opportunity. Thank you for hosting this podcast and making it available to not just Ohio Counseling Association members, but a wider range of those interested in counseling and professional care.
Yes, thank you. We're so grateful, and we know that our listeners will be grateful for this empowering, motivational conversation. Thanks again for joining us, and thank you, listeners, for listening. We will catch you next time on Ohio Counseling Conversations.
Ohio Counseling Conversations is on a mission to make this podcast meaningful to you, and we can't do that without your help. A feedback form is linked in the show notes for this episode and is also available on the OCA Linktree. If you have any recommendations for topics or guests or any other general feedback, you can let us know by using the form. We welcome your thoughts so that we can continue to develop the podcast and grow as creators. If you are interested in joining the team or being a guest, you can also reach us by emailing ohiocounselingconversations@gmail.com. We value your insight. Thank you so much for listening.
If you enjoyed this episode, please make sure to follow us so you can stay up to date with Ohio Counseling Conversations online and wherever you listen to podcasts.
This podcast is brought to you by the Ohio Counseling Association's Media, Public Relations, and Membership Committee and its podcast subcommittee. This podcast features original music selections by Elijah Satoru Wood and our closing song, A Creation Discotheque by Who AD. Views, beliefs, or references mentioned in this episode do not constitute an endorsement or recommendation by the Ohio Counseling Association. The views expressed by guests are their own, and their appearance on the podcast does not imply an endorsement of them or any entity they represent. Views and opinions expressed by guests do not necessarily reflect the view of the Ohio Counseling Association or any of its officials. Thank you.